Okay, so here I'm going to show you the flossing of the cervical nerves. And there's three main nerves going down the arm. We're going to do the median, then the ulnar, then the radial. And you can test both sides. Now, if you have significant pain with either of these, and that will be pain in the neck or down the arm, it's usually not indicated. It could make you worse. If you just feel a tightness, or if your therapist has told you it's okay to do, then you want to test this. And what I suggest is do 10 reps per side, and that's it. Leave it for the day. See what happens over the next 24 hours. If your symptoms aren't worse, maybe you're even a little better, then you can do it again. And you do that once a day, 10 repetitions per side, see what happens. If you tolerate that for multiple days in a row, then you can start to increase the frequency, maybe do it 2 or 3 times per day, but it doesn't take that long. All right, so median nerve. Straighten the elbow, bend the wrist back like this. Try to relax the shoulder. So part of the putting the tension on the nerves is to depress the shoulders. You want to let this drop. So I'm gonna go like this, and then I'm just gonna bring my head away from my arm. And just test it to see, do I feel anything severe or intense, all right? So the exercise to floss is as I'm bringing this arm straight and the wrist down, I leave my head either centered or even a little bit to the same side. And then as I release this, I stretch the nerves of the neck away. So this is tensing the top, relaxing the bottom. This is relaxing the top, tensing the bottom. So that's 1 repetition, right? So it'd go about this speed, and then 1 repetition. 2. You would test and do both sides if it's indicated. Ulnar nerve. Now remember we used to do this when you were a kid? So this action stretches or tenses up the ulnar nerve. So if you can get here, you can do that. If not, just work on turning your hand to kind of face up and bring your elbow back and still relaxing the shoulder. Right, so this, if I'm in this position and I bring my head to this side, I'm getting tension throughout the whole neurological structure. To floss safely, again, when I come up here, I bring the head to the same side, and then when I relax that, I take the head away. 2, and then relax. Right, so this is stretching the bottom, releasing the top, stretching the top, releasing the bottom. Okay, finally the radial nerve. This is the waiter's tip position. So if I put my hand back behind me and kind of bring my fingers up like I'm gonna be accepting some money here, that's the position here, right? And so I'll just do it at this angle. So if I come back in this position and I bring my head away from that same side, bring the shoulder down, that's putting that maximum tension on the nerve. All right, so the way I want to do this floss is when I bring this back, I bring my head to either neutral or a little bit to the same side, and then when I relax that, I stretch it the opposite way. All right, tensing up the bottom, relaxing the top, stretching the top, relaxing the bottom. 10 times per side, and then assess.